Okay, well, hello, welcome again to Zacks SCR and ZIA, Zacks Investment Awareness. And we're here talking about some predictions, if you will, about 2017 and especially the upcoming JP Morgan Healthcare Investor Conference in San Francisco next week. Joining us today are Zacks analysts with a lot of expertise and experience in this area. We have Anita Dushyanth, who is a medtech analyst for Zacks. And we have John Vandermosten, who's a biotech analyst, also for Zacks Investment Research. So I'm going to turn it over to Anita and John and just run through a few thoughts they have on the upcoming conference, as well as some trends they're seeing in their respective areas of expertise. Thanks for joining us, guys.
Thank you, Jeff, and good day to everyone. Thank you all for attending. As Jeff mentioned, my name is John Vandermosten, and I'm one of the healthcare analysts here at Zacks covering biotech. I spend my time focused on a number of therapeutic areas, including cardiovascular disease, hepatitis, novel drug delivery methods, and other areas. As the title of our presentation says, we're going to discuss some of the key themes and trends that we've seen in the last year, and also attempt to predict some of the exciting things that will happen in 2017. So hang on, and here we go. 2016, it was an exciting year. The broad market was up 12%. But healthcare was down 4.4%. Biotech was one of the weaker industries, with S&P 500 constituents falling 14%. Being an election year, politics took center stage, with both concerns and optimism over healthcare policy, touching on a variety of areas, including new and old legislation, drug pricing, and advances made in cancer research. You can't talk about any year without giving some attention to mergers and acquisitions. Deal size and the number of deals slowed in 2016 compared to the prior year as the markets gave us a volatile ride. Pharma M&A in 2016 was $177 billion, and this compares to $300 billion in 2015. A few factors led into this decline. Election-related debates, they fed uncertainty regarding what the future might hold for pharma acquisitions, and also the failure of tax inversion deals such as the Pfizer-Allergan combo. Were a couple of reasons behind the decline. Despite this uncertainty, there were a few themes to the acquisitions that did take place. Cancer was a busy area with the headlines dominated by Pfizer's $14 billion acquisition of Medivation that will provide access to Sandy and also fill out their cancer portfolio. Another area of transaction interest is in the generic space, where market leader Teva made two important buys. There were also a number of other foreign generic transactions, which I've listed here on the slide. Rare diseases and medical diagnostics also saw some interest, including Horizon's purchase of Raptor to gain access to their drug for nephropathic cystinosis. We heard a lot in the news about the ACA, about repealing it. But one of the big legislative actions of the year was the December passage and signing of the 21st Century Cures Act. This provides additional incentives to allow for faster approval of drugs and faster approval of new indications. The Act will provide for easier approval to obtain breakthrough designation and also the use of surrogate endpoints in place of clinical benefit to obtain FDA approval. The legislation also recognizes the pervasive and growing epidemic of opioid addiction and will provide more programs and training to address this problem. The Cures Act will appropriate $4.8 billion to the National Institutes of Health for research on brain disease, Alzheimer's, and cancer research. Just a side note, there have been a lot of trials and efforts and investments made on the Alzheimer's side of things, but there's been little progress made, and it's hopeful that the changes in approvals here for the FDA and also the funding and attention that's provided from the Act will help make progress in this neurodegenerative disease. So taking a look here at the FDA's actions over the year, drug approvals in 2016 were more than cut in half over the prior year, with only 22 new molecular entities approved. I provided a historical chart here over the last 20-plus years where we can see kind of how the trend has gone. Taking a close look here, clearly 2016 was below the average that we've seen over this period. And there are a few factors that contributed to this. One of those was early approval of drugs at the end of 2015, fewer overall applications, and also a higher rate of rejection or delay for medicines that were submitted. The last drug approved for the year was Biogen's Spinraza, and this is for the treatment of spinal muscular atrophy. On the other side of the pond, the EMA approved 81 new and generic prescription products last year, and this compares to 93 that were approved in 2015. So now on to the big topic. We haven't gone more than a week or two without hearing some new news in the drug pricing arena, and it's been from the media, from presidential debates, and also congressional hearings in a number of other areas as well. For the last several years, we've seen a consistent trend in consolidation in generics, and I gave a few recent examples of this in the earlier M&A slide. As there are fewer manufacturers, this has supported price increases. Some see the poster child for generic inflation in Valiant, who focused on raising the price of several niche generics. EpiPen was also a well-publicized example of a better-known treatment. Insulin is yet another, and we can see here on this chart, included with the slide, the inflation over the last 8 or so years from about $12 to $40. I calculated the CAGR on this. It's about 15% per year, which far exceeds the drug inflation overall, healthcare inflation, and also definitely just the overall inflation in the economy. As some efforts were made to push back against prices, including Proposition 61 in California. If passed, this initiative would have tied prices paid by the state of California to the price paid by the Veterans Administration. The ballot measure ended up failing, but further similar efforts may be a risk in later election cycles. Other actions taken were that 20 U.S. states attorneys general filed a lawsuit naming 6 drug companies, which I list here on the slide, as working together to set prices for an antibiotic and a diabetes medicine. The suit was filed less than a month ago, but the investigation has been ongoing for more than 2.5 years. So we'll have to keep a close eye here to see how that progresses. And the last drug of the year, mentioned this earlier, last drug to be approved was Biogen's Spinraza for spinal muscular atrophy. Pricing for the first year of therapy was announced shortly after approval and was set at $750,000. This is clearly a very high level that's sure to draw attention from payers, patients, and politicians. There's definitely a level of risk to the pharma industry from prices that continue to break new records, whether it's payers refusing to add these drugs to formularies, insurance prices rising to unaffordable levels, or some other broader action. It's difficult to see the pricing trend continue at this rate for an extended period. Now, I'd like to pass the microphone on to Anita Dushyanth, who will cover some of the trends in medtech. Anita?
Thanks, John. Hello, my name is Anita Dushyanth, and I've been an analyst with Zacks since 2014. At Zacks, my research involves in-depth analysis of small and microcap companies, my specialty being medical device-related firms. In the past year, the medtech sector has performed better than biotech. The medtech ETF IHI has been up 9% as of December 2016. Today, I would like to briefly touch upon a few topics, including disruptive technologies in medtech industry, including personalized medicine, wearable monitoring, wearable devices, companion diagnostics, to name a few. Diagnostics is the key to personalized medicine. The top therapeutic categories beyond oncology to be impacted by personalized medicine are pediatric disease conditions, anti-infectives, diseases associated with the cardiovascular and central nervous system. With the growing demand in personalized medicine, there has been growth in companion diagnostics as well as advanced diagnostics for screening and risk assessment. A few companies that are focusing their efforts to make personalized medicine a reality are biomarker strategies who are developing predictive tests to guide targeted drug development. Inivata is developing tumor analysis that helps improve treatment for cancer patients, and ISA Pharma is developing a therapeutic cancer vaccine, and that is to name a few. Technology has allowed the mapping of internal organs or implants that can be translated to 3D printing objects, and this provides an unprecedented design and manufacturing flexibility. There is a tremendous runway left in the 3D printing space as it is just beginning to scratch the surface with hearing aids, dental implants, and prosthetic limbs. Celprogen announced that they finished printing a 3D pancreas from a flexible polylactic acid material that was populated with pancreatic stem cells. 3D printing can completely customize an implant to the exact required dimension and be delivered to the surgical ward almost immediately. This completely changes the dynamics of the supply chain business model, the manufacturer versus the distributor versus the hospital. Wearables is another segment within the medtech space, and healthcare is the fastest growing segment for wearables due to the overwhelming need to monitor diseases associated with aging population. Wireless technologies are enabling medical practitioners to monitor and provide treatment remotely to individuals with complex medical conditions, disabilities, and those in areas with reduced access to care. Medical wearables sector can be divided into three categories: wearable therapeutic medical devices like hearing aids, insulin pumps, wearable monitoring and diagnostic devices like glucose monitors, heart rate monitors, and blood pressure monitors, and those that are already in the market, including health and fitness devices. The wearable technology, such as Google Glass, is a dynamic eyewear and has multiple applications. Neurometrics product Quell is being developed as a therapeutic device for chronic pain. Bigfoot Biomedical is developing bionic pancreas to automatically manage glucose monitoring and insulin delivery. The Wyss Institute at Harvard University and Rewalk Robotics have collaborated to develop wearable exosuits for patients with limited mobility. The venture capital funding for biosensing wearables increased fivefold from 2011 to 2013, reaching close to $300 million, and this illustrates the market interest in this sector. Digital health technology is creating a paradigm shift in life sciences. Health data captured by wearable devices, mobile health apps, and social media are being used to transform aspects of healthcare. There has been a rise in online patient community platforms to gather large volumes of data from patients about drug side effects and patient interactions. One of Merck's projects initiated in 2014 is focused on capturing and leveraging this patient data and turning it into insights to help solve unmet needs of patient communities. One of the barriers to making progress in cancer treatment is to provide immunosuppression in the tumor site. Right now, one of the most promising frontiers in cancer treatment is immunotherapy, that is, engineering patients' own immune system to combat a wide range of cancers. Researchers are using nanotechnology to deliver therapeutics selectively to cancer cells and enhance therapeutic efficacy of certain treatments. Researchers from the University of Texas have developed a threshold nanosensor that can differentiate between cancer cells and healthy tissue during surgery. This nanosensor-guided surgery has potentially many advantages, including accurate removal of tumors and greater preservation of functional normal tissues. Many institutions have initiated data sharing like AACR's Project Genie, which hopes to help facilitate biological characterization of cells, which will help researchers develop patient-specific cancer treatments. A growing global market provides medical device manufacturers with an opportunity to broaden and diversify their geographic revenue base. The global population of people of over 65 years of age is expected to rise up to 1 billion by 2020, and the devices used in the treatment of age-related illnesses such as cardiovascular and respiratory diseases might see significant growth. Further, the rapid expansion of economic growth coupled with greater access to healthcare in developing economies offers a tremendous growth opportunity. GE Healthcare has been a pioneer in this area and have made significant investment in R&D several years ago. Their battery-powered EKG system is not just used in the developing world, but is very successful in the US as well. This also highlights the power of reverse innovation. A product created in developing economies makes it affordable for everyone across the globe. Growth by acquisition still seems to be MedTech segment's go-to strategy. In summary, the first half of 2016 witnessed MedTech M&A activity that reached nearly $80 billion. Global MedTech segment revenues are expected to grow at a rate of 4% annually, with neurology being the fastest growing segment. While the Western regions remain the world's largest medical device market, the Asia and the Pacific markets are also expected to expand at a quicker pace. In the new year, under a new administration in the U.S., it will be exciting to see how the MedTech sector is transformed by emerging technologies. With that, I'd now like to turn the call back to John.
And thank you, Anita, for the review of the medtech space. It was very interesting, especially to hear the part about the 3D printing. Definitely an area of interest.
Regarding 3D printing and just how far we are and the challenges we're facing with 3D printing and tissues and organs.
So 3D printing has enabled a lot of printing of biocompatible materials. Currently, as I had mentioned before, they are now in the hearing aids and in the spinal implants sort of things. But in order to move ahead and start printing organs and tissues, there are other challenges involved with actually dealing with functional living tissues. In the regenerative medicine space, 3D printing involves additional complexities like choosing the right material for the specific cell types and how these grow around them, and technical challenges associated with living cells. They need to be able to be biocompatible as well as they should be suitable for transplantation. So addressing these complexities involves integration of several fields of science, physics, and medicine and engineering. So they've been used so far, but I think they're still in their nascent stages to get to printing graft for skin and hard tissue, maybe, but it's getting close. We should see some developments in the coming years.
Thanks, Anita. That's a great answer and very interesting stuff. We're looking forward to seeing all kinds of very, very advanced things with 3D printing.
And on our final slide here, you can see what we look like, and also find our addresses on Twitter. We'd love to have you follow us, where we put out relevant news for the industry and also relevant news on our companies. And again, to access our research, please see scr.zacks.com, and you'll find a link to all of those companies on the prior slide. And then you can also contact either Anita or myself at the phone number or email listed here. We'd like to thank you all for your time and invite you to listen in at the JP Morgan conference and go Biotech in 2017. Thank you all for listening. Bye-bye.